Last question, and I've finally dug out from the backlog, and I can start on new questions. All right, yeah. This question is from Marge. Thank you, and good morning, Marge. Question is, what does Dr. Ben say about Michael Mina's article in Harvard Magazine? And so I had to read ahead and pull this thing up and have a look at it. And yeah, so the article says, well, it's right there in the title pretty much. Let's see. Cheap, frequent COVID tests could be akin to a vaccine, like that. Frequent testing would have the same overall effect on a vaccine. This person, I don't know this person, but this person is apparently an epidemiologist. I just got to say, that's a very epidemiologist answer. That is, yeah, an extremely sort of public health epidemiology based, because what he's saying is true in the large sense. If you're able to do this for everybody and you're able to take appropriate precautions once people are positive, basically keep them away from people who are negative, then that can have the same effect as a vaccine, in that the virus goes away. It'll limit transmission. That's basically just good public health. That's like the stuff we've been talking about since, I don't know, February, March, whenever we started this thing. Yeah. Test, trace, isolate. Yeah, boom. Yeah. It's super easy. ABC. I would say this works out on a mathematical level for people treated as a large group. On an individual level, I think it depends what you do with the test results and whether people take the test. I think there's right now a lot of pushback against anything that would be actually protective. It's like almost a point of honor among some people to say that this isn't real and you shouldn't take any precautions, and damn the torpedoes, full speed ahead kind of thing. Which, yes, great for movies, a lot of bravado there, but really bad idea from from any standpoint. From a personal infectious disease standpoint, like getting a little bit smaller, I would say this can work, but I would worry some people will still get the virus because they're not taking. So it would have to be a ton of testing along with taking precautions not to get infected in the first place, like full-on mask wearing plus a whole bunch of really rapid testing. Yeah, together I could see those being as good, getting us to the same place, actually driving the virus extinct. I don't think the vaccine actually leads to extinction of this virus. I think when we get the vaccine, if we stop doing all the other stuff like wearing masks that actually works, I think then we have to deal with this virus kind of forever. People are looking to bail out. They got their hand on the ripcord. They're hanging 1 foot out of the plane, just saying, "Hey, yeah, I'd like to bail out of this precaution taking stuff because it's annoying and hot and just super intrusive, invasive. Yeah, there's nothing about it that really makes you feel good." Yeah, but at the same time, this is actually the stuff that works, and so it's the most valuable stuff. So yeah, I see the point from an epidemiological point of view. That totally makes sense. I guess I don't know. Maybe I was gonna sound like a old man in a cave saying I've seen too much of humanity during this outbreak to trust that people will do the right thing. But that's just a grumpy old person kind of point of view. I like it. I think it's part of the solution along with precautions, and it's an essential part of the solution along with precautions. We basically have to be getting to the point where we're testing everybody every week. Get to that point, and we can hammer this thing down to very low levels, and then it's going to take a while to get the last cases. They're going to be people that are just too far from a test or are somehow marginalized, like they're homeless or something like that, and they don't live at a place, and so you can't just count up and make sure you've got everybody tested. Basically all the people that the census misses are the people that testing is probably going to miss, and I worry about that. But it's not an insolvable problem. It's just a problem that's going to take a while. And you just got to sit there with your little chisel and chip away until it's all gone. So, yeah, I like it. So this is one of the chisels, a nice rapid test. Yeah, sure. Let's go. Let's go. Throw that, put that one in the quiver too. We got more options. Yeah, things we can shoot at this virus. Thanks very much. This is Ask Dr.